Hemorrhoids in or around the anus, urgent care, light bulb in the anus, emergency department. Well, there you go. Smashed toenails, missing light bulbs, and a UTI versus an MRI? What? Today I am breaking down and discussing the ultimate head-to-head battle of the urgent care versus the emergency department. All right, let's dive right in. Step on a mouse trap, urgent care. Step on a bear trap, emergency department. If you have a minor injury, maybe need an x-ray, you could probably go to an urgent care. They can, sew you up if you have a small laceration. They can get an x-ray if you have, a small injury that needs to be, evaluated to make sure you didn't fracture something. Versus a massive bear trap, could be an amputated leg, horribly infected leg. You might need to actually go to the operating room, have it washed out. You might need to have it externally fixated. So a lot of different things that would happen in that situation. So right on the money. Need antibiotics? Urgent care. Need antivenom? Emergency department. If you're having a simple infection that might require antibiotics that are oral, then you would actually go to those areas. If you're requiring something that's highly specialized, you may need to go to the emergency department. So say you get bit by a rattlesnake, you may need some antivenom. Antivenom isn't everywhere, and maybe not every emergency department has it, but at least going to the emergency department, you can get evaluated quickly and you can have somebody talk to poison control, have a lot of resources, get an IV started, have a nurse check things out. You have the flu, urgent care. You have the plague, emergency department. So this is good because this is relating to different types of infections. Now, the flu, upper respiratory infection, not feeling good, body aches. It is a viral illness that there is a medication called Tamiflu that we commonly use. There are issues relating to when you'd actually need to go to the hospital and to the emergency department when you have the flu, when it becomes an issue relating to difficulty breathing, your oxygen saturation is low. So the plague, bacteria treated with antibiotics, and the plague has killed millions of people, and it's not as common anymore, but it is still around, but easily treated. But you want to head to the hospital to make sure you're evaluated. Step on a bee, urgent care. Step on a beehive, emergency department. You step on a, get a bee sting. Some people are allergic to it. Some people are not. If you're not allergic to it, it's like a small sting, hurts, it'll go away, maybe a little inflammatory reaction right then and there, and you're fine. Some people may have an allergic reaction.
A lot of Benadryl.
That requires like antihistamine, Benadryl, maybe epinephrine. You step on a beehive and you get multiple stings, then the inflammatory reaction could be so great that you tank your blood pressure, meaning that you become so hypotensive and it's a life-threatening event and you need emergency care to immediately step to the plate and save your life and get you admitted to the hospital, admitted to the ICU. UTI, urgent care. MRI, emergency department. This is with a big caveat, okay? So UTI, urinary tract infection, we also call it cystitis. That is basically where you need antibiotics. You're having discomfort with urine. It is very common, more common in females than males, and it has to do with actual anatomy and how long the urethra is. But as long as you're not septic and you don't have pyelonephritis, which is an infection of the kidney, then typically it's oral antibiotics for anywhere between 5 to 7 days, and you'll do just fine. MRIs are done in the emergency department in an emergent setting. A lot of people will come to the emergency department wanting an MRI for a chronic problem that they have, and unlikely would it be able to get done. But if you're having a spinal cord injury, an acute stroke, those are, basic indications to get an acute MRI done. Thump, urgent care. Thump, 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 emergency department. So falling down. So if it's a simple fall, maybe a ground level fall, you're able to get up, you're able to walk, and you just need, say, an x-ray or having evaluated to make sure you're okay, urgent care. But if it was a massive traumatic injury, lots of bouncing around, then maybe emergency department versus even a trauma center where you get x-rays, CT scans, which are quite fast, to make sure that there's no life-threatening underlying issue that needs to be addressed immediately. And hopefully it's just bumps and bruises. Hemorrhoids in or around the anus, urgent care. Light bulb in the anus, emergency department. Well, there you go. Okay, so hemorrhoids. You can have internal hemorrhoids versus external hemorrhoids. Internal hemorrhoids typically bleed a lot. External hemorrhoids can bleed, but they're very, very painful. It has to do with where they are in the dentate line, which has to do with the hemorrhoidal tissue and the nerves that are involved. Typically, people will be sent to the emergency department by either urgent care or their primary care doctor to have a hemorrhoidectomy, or basically have the hemorrhoid removed, versus foreign bodies up in the anus, or probably at that point it's going to be your rectum. Depends on how far up it is. Sometimes you can get it out manually in the emergency department. Sometimes the patient actually needs to go to the operating room and either be opened up to have it removed out of the colon, or you can do a colonoscopy or sigmoidoscopy to try to visualize it and grab it and pull it out. Breakout, urgent care. Outbreak, emergency department. Breakout, okay, maybe a rash, maybe a small infection, something simple, easy, get checked out, have your skin looked at. Major outbreaks, obviously, we had something happen a few years ago. Get to the hospital, we have quarantine rooms, we have negative pressure rooms. That way we can safely protect you, protect everybody else, and make sure we can address something quickly. I remember at the beginning of COVID-19 in the early 2020, when I had to experience one of the first cases at our hospital, very interesting, but we put the patient in our negative pressure room as well as, quarantine that area and make sure that the patient was fine. Hammer got your thumb, urgent care. Hammerhead shark got your thumb, emergency department. So yes, you smashed your thumb with your hammer. That, depending on how bad you smashed it, sometimes you can go to the urgent care, sometimes you actually might need to come to the hospital. Just depends. We usually have the ability to talk to an orthopedic surgeon or a hand specialist to guide us. Sometimes it might need to be amputated, it might need to go to the operating room versus just suture close, antibiotics, and sent home. Versus a hammerhead shark bite. Could be an amputation, could be, bad infection due to the different bacteria related to the salt water and the bite itself. So needs to be evaluated. Not something that they would do in the urgent care. Sunburn, urgent care. Chemical burn, emergency department. Sometimes could you go chemical burn to an urgent care? It just depends on the extent, but this is like a massive chemical burn where you need to be decontaminated. Basically, we have all these different types of showers outside of the ER. There's different protocols for exposures. That way you don't expose other people and staff at the hospital. If you show up into an urgent care with that, they will not be able to handle it. Lots of different things can cause these type of burns. Big things, obviously, are the acids that are out there, but you also have to think that basic things can cause burns as well. Versus a simple sunburn. Sunburn can cause a 1st-degree burn, could cause a 2nd-degree burn where it blisters, unlikely to cause a 3rd-degree burn. Typically it's pain management, moisturize the tissue, you'll be okay. If the blisters open up, make sure they don't get infected. Toenail smashed, urgent care. Smashed nail through toe, maybe go to the emergency department.
Fiddle-dee-dee, that will require a tetanus shot.
Toenails, yes, okay, very painful. The nails themselves are there to protect the nail bed itself. So if you smash it, it can probably be fixed at an urgent care. You may need an x-ray to make sure you don't have a tough fracture, but again, treatment's about the same. If there's a laceration, they could sew it up as well. You can actually put a needle straight through the nail and actually tack it down. But a nail through it, again, needs to just have the consultation with a specialist. So we can remove the nail, no problem. We can get an x-ray to see if it went through the bone, but then the bigger issue is, one, obviously you'll most likely get a tetanus shot if it's not up to date for you already. But then antibiotics, do you need to go to the operating room? Is the bone at risk for getting something called osteomyelitis? So again, multiple different things that would have to occur with multiple different phone calls, which is done easier in an emergency department than it would be in an urgent care. I hope I was able to provide some insight into the differences between the emergency department and the urgent care. They are, comparable by physicians and staff members, but there are a lot more resources in the emergency departments. So that's something to be aware of. Also, check out my new supplement company called Life Happens. If you guys enjoyed this video, definitely check out similar videos right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.